And the bird flu has spread to 12 states, and so far, 4 farm workers have been infected with the H5N1 virus after direct contact with infected cows.
The outbreak is prompting local health officials to take notice and start preparing for the worst. Joining us this morning is Dr. Eric Ascher from Northwell Lenox Hill Hospital to discuss the threat of the bird flu to our area. So good morning and happy 4th of July to you, Dr. Ascher. Thanks for coming in.
Good morning. Thanks for having me.
Okay, so far, the Centers for Disease Control and Prevention say that the risk to getting bird flu to the general public is low. There have been no cases reported in humans or animals, livestock in our area. But you hear about an outbreak like this, and of course it kind of sends people into a panic. But first and foremost, will it eventually come to our area? Is that pretty much a done deal or not?
So, great question. You know, right now the risk is very low. We haven't seen a lot of human transmission. There's only 4 cases since the early spring, and none have been in New York. So what we learned from the COVID-19 pandemic is prepare for the worst. So our offices, our hospitals, we're prepared. We have the equipment, we have the staff, we have our supplies. But right now, like I said, risk is low. We're not expecting crisis, but we're monitoring. We haven't seen a spread of the H5N1 in as much cattle before. And we know the longer that there is a spread, there's more chance for mutation, so it's possible. So that's why we're getting prepared. But right now, we're not worried about a huge risk.
We know for now the outbreak is contained to dairy cattle in the U.S. and over in Iowa. 4 million chickens were killed in May following an outbreak there. So should we be concerned at all about the food supply at this point?
Yeah, so right now, if our food is cooked properly, and it's important especially for a big grilling weekend of meat and chicken, if our food is cooked to the appropriate temperatures, minimum 165 degrees Fahrenheit, there's no risk of it being in our foods. And similar with milk. If you're getting your milk pasteurized, which is what's recommended, there's no risk in your milk supply either.
What are the symptoms, though, of bird flu? Is it like a regular flu, or is it something different?
So the most common symptom, and what was seen in these 4 individuals who got H5N1 recently, is conjunctivitis or pink eye. But symptoms are very, very mild. Cough, congestion, headache, watery eyes, similar to the regular flu. And what's great about this currently is that Tamiflu, the medication that we commonly use for flu, is very effective for the H5N1. And all 4 of those individuals within our states have fully recovered.
How do they test for bird flu?
So it's the same flu test that you would get as though you were going into your doctor or urgent care for a flu test. But most of our tests are then sent to an additional lab where they can subtype it and see if it is the H5N1. But currently, the country is developing a specific H5 test just in case we need it.
Now, there are different strains of bird flu. Are any of them perhaps deadly?
No, so far we haven't seen any deadly strains of the bird flu, especially in this current, what we're currently monitoring and watching, but only time will tell.
And how is it transmitted?
So it's transmitted, what we're thinking is just from if there's an infected animal, whether it's the cattle or the poultry, the cattle worker or poultry worker breathes in the infected aerosols, and then they get infected.
Is there a vaccine perhaps in the works down the line?
So there are vaccines that are currently being developed. We're looking into Moderna, which helped create our COVID vaccine, because that technology will allow a faster supply to be created if needed. So we're exploring it just to be prepared, but I don't think that we're going to need it.
Well, you mentioned COVID. Obviously, we learned a lot of lessons from COVID. What are some of the lessons that you've learned from COVID then in dealing with something like a possible pandemic with bird flu?
Protective equipment is very important. So the CDC is currently recommending all poultry, cattle workers to use protective equipment, goggles, masks, gloves, and any of those workers should get tested right away, similar to what we would recommend for COVID, if they're exhibiting any symptoms at all.
How are local hospitals kind of getting ready for whatever comes with bird flu here in the city and areas?
Yeah, so we're fully prepared. You know, we have really, since COVID, made sure that we're always have extra staff on hand, always extra supplies, testing, and the ability to open testing sites overnight, the ability to share our supplies with individuals who need it, stocking up on medications like Tamiflu. We're there, we're prepared.
Now, we already talked about how there are no cases here. We don't see it in humans or livestock. But there are a lot of people traveling because we're
Yeah.
heading into summer. A lot of people are on vacation. They're heading into areas where there is bird flu. Is there something that we should do if we're traveling to these areas that have cases in order to protect ourselves?
Yeah, I've always recommended testing. So if you're headed to a spot and then you're exhibiting symptoms while you're there or after you leave, get a test, because that's the best way to ensure if you have something, then you should protect yourself and quarantine. If you don't have something, then, explore, live your life, and go about your daily activities. But testing is very important, and just keeping a watchful eye, monitoring the situation. If you know that you're going to be headed to a place where there is a high amount of outbreak, then maybe you should, think about delaying those trips.
Good idea.
You have to stay informed there. Thank you so much, Dr. Eric Ascher. Thank you for spending part of your holiday allaying our bird flu concerns here. Thanks again.
Of course. Thank you.
Have a safe holiday.
You too.